Hi guys, welcome and welcome back to my channel. And in today's session, we have a guest with us. His name is Michael Odero. He's the Secretary General of the Kenya Union of Nutritionists and is also a registered clinical nutritionist practicing under Middle Health Solutions. It is said that HIV doesn't kill, malnutrition does. So Odero is going to give us an insight of how to prevent the malnutrition that causes death in HIV patients. So Odero, karibu sana.
Thank you so much. This is what happens with the HIV. HIV will lower your immunity.
Yes.
When it lowers your immunity, it gives chance to operation of other pathogens and disease-causing organisms, which will kill you.
Yes.
And once your immunity is low, the easiest way to improve your immunity is through nutrition. When you have HIV virus in your body and the viral load goes high, your immunity comes low. Before your immunity comes low, the total energy need for your operations in a day goes up because you have a foreigner in your body.
Yeah.
Now, when your total energy requirements goes up, it means your nutritional requirements goes up.
Yeah.
When there's high nutritional requirements, the first thing to do is to meet the requirement.
Yes.
Now, if you fail to meet the requirement, that is when malnutrition crops in.
Yeah.
When we have the malnutrition in, the easiest way to prevent it, once you know that you have the virus, is to get a dietitian who should help you work on your normal requirement at normal health. And then it will increase the extra need when you have the disease. Another thing, if you increase the need, but you don't do the appropriate rationing, there are high chances that you will not meet the requirement, because the requirement is in two ways. We require the food to build our body, we require the food for growth, and then we require the food for general activities, and we also require the food to maintain the body.
Yes.
So
and also to fight the
diseases.
Yeah.
Now, if you don't balance it for all those aspects, then even if you put a lot of energy alone, then you are still not going to get what is required, and still you can run to malnutrition.
Yes. So you've said that it is important that we adjust our nutrition intake, uptake, rationality, and portions in accordance with the disease and our general activity, so that we don't go to malnutrition. So that is basically how HIV affects our nutrition intake. So how does HIV affect our nutrition status? Like for someone who's HIV positive, we've talked about the nutrient uptake becoming high. So what happens to this someone who has HIV and they have not started on nutrition interventions?
Now, if you have HIV and you have not started on nutrition intervention, already your need has gone up.
Yes.
Remember, primarily, human being needs specific amount of nutrients to maintain them.
Yes.
Now, if this pathogen is in your body, the need goes up and you don't take appropriate nutrient requirement, then that is when your body starts breaking what is up.
Yeah.
And that is what results into HIV patients whose intervention on nutrition is not taken care of, they go down to be emaciated or wasted, because the body is breaking what is already there. And as you break down and become emaciated, based on your height and weight, your immunity goes down. When your immunity goes down, that is when the malnutrition is going to make other pathogens, and then that is what is now going to kill you. So if somebody is well nourished, they will live longer with the HIV virus and when under medication, as opposed to somebody who is in medication but is not well nourished. Those are key areas we have to take. So even if you are in medication, your nourishment is key in ensuring you prolong your life with HIV.
In the past, HIV used to be the disease of the thin man. But you are currently having both cases happening.
Now,
Can you
I
comment
want to
on that?
comment on that, and it is a very good green area, but a good area for most people. You will realize that with medication in, there's drug-food interaction. And we have seen so many cases where people who are on ARVs become overnourished and now die, not because of the HIV, but other complications associated with undernourishment. For example, the case of hypertension. Some of the drugs used in HIV have the capacity to make somebody develop high fat content in the body. That is, if they are not checked well with how you use your nutrition, and this may result into other complications. The theory of the thin man disease is no longer there. And again, for the part of appropriate sexual behavior. People go into HIV because of a perception. They think this man is fat, he might not, or this woman is fat, they might not be having the disease. Now, this man might be well nourished, and in the well nourishment, he is also doing the drugs well. But there's something lacking into balancing the nourishment, the foods they take, and the drug. This will result into them going overweight. So you see a very fat, healthy person, but in real sense, these people are having virus. The caution with that is, if they are fat, yes, and their viral load is low detectable, that means they are eaten well and the immunity has covered the virus to a level that they cannot be seen in the system, then if you make that mistake, you are safe. But how many mistakes of that kind can you make to be safe? The primary thing is, for sexual behavior, ensure you are going with the person you know and the right person primarily, and then your nutrition and the nutrition of the person you are going with. Even if you are HIV negative and you decided to take an HIV positive person, then ensure you know their nutrition intake and then how they use their medication so that you get protected from the one.
Key pointers, because people believe that if you have HIV and you're taking medication properly, you're good to go. Medication alone is not enough in management of HIV. For you to have controlled CD4, it has to be intermarried so that it can work best for you. Okay, Odero, now you can kindly tell us a brief, like if someone has HIV, maybe they have stage 1, stage 2, because they're different stages, how should they adjust their nutrition uptake, their nutrition status? What can guide them into that?
That is where we go to individual. In nutrition, there is no blanket guideline that I'm going to give that person a prescription to help them. But we'll go with the based on your activities and then your interaction with the environment. Now that will dictate how much we are. For example, you will find an HIV positive patient who does a mjengo work. This person, in his healthy state alone, he has excessive needs. So you have to sit down with the person and calculate their activity levels, and then add the extra required from the activity of HIV in the body, and then plus their maintenance level, and then come up with total nutrient need. And that's why we say, at that point, you need to see a registered dietitian or a nutritionist in that perspective to help you maintain that. Generally, we say, for a general guideline, the 3 conventional WHO meals will not be enough. Add extra 2 or 3 snacks, but if it is not guided to be individualized, then it is not going to help you. That means I have to sit down with you, do my calculations, and see I need to add you 500 extra kilocalories,
or even 300,
or even 300,
or sometimes
something. Or do I need to cut down because you are overweight, and then look at those aspects and then come up. And that's why you will see in an hospital setting where care is well, a patient comes in. Some are given nutritional support to carry home, but some will not be given. The reason is, at the need assessment level, when you're doing the screening, your need finds out that you don't need to be given. But at other aspect, your need finds out that you need to be given. And one aspect which has been left out in dealing with the HIV patient is individualizing their diet plan and eating plan. You know, you are in this family of 10. By bad luck, you are HIV positive. You cannot eat, even if you are doing your rationing to add those snacks, you cannot do them as the same way that other people do them, because your needs are totally different. And don't leave out one aspect of socio-economic factor when dealing with HIV patients, and the functionality factor. There's a patient, the functionality will allow them, but socio-economic factors will not allow them. Then there's a patient who can add, socio-economic factors can allow, but the attitude aspect cannot allow. So it calls for individualized approach and ensure all-round assessment is done to these patients to meet those requirements.
That is very important. So individualized care is important. Proper assessment is also very, very important. If you have HIV, it's not a death sentence. HIV can be managed with proper nutrition, proper care, both mental, physical, nutrition, and medication. I would like to add on what Odero has talked about. When you have HIV, you are nutritionally at risk, because HIV, just like most other chronic disorders, is usually very catabolic, and you can easily run into wasting if you're not taking care of yourself. We also have the burden of overnourishment and obesity, and this is basically attributed to the good adherence of drugs and maybe other conditions that contribute to obesity. When your immune status is compromised, that is basically your CD4 count is compromised, you're bound to get infections like bacterial, fungi, and yeast. So when you take up things like cultures that have probiotics, cultures that have good bacteria, you're going to increase your good cultures, and this will help you in fighting off infections. So taking up fermented foods like yogurts, taking up fermented foods like fermented uji, fermented drinks, cabbages, carrots, all these are very important to ensure that your cultures are well. And another thing, HIV patients suffer a lot of infections like the STIs, the UTIs and such. These cultures help with that. The 7 rules that I live by for HIV patients: eat your meals well, sleep well, drink enough water, take your medication, practice safe sex, take up probiotics, and do your best. Pray for goodness. Thank you so much for watching. Thank you so much, Adora, for honoring us with your presence. And until next time, make sure that you watch this video on healthy eating habits to help you eat better, and it can also be applied for HIV patients. That was it from us. Bye.
Bye.